Alright, I have Miss Margaret Snowden here, and she just recently had a double mastectomy and is about to start chemo and radiation. Her oncologist has recommended her to get a prophy to make sure that her teeth are extra clean before she starts treatment. And so I would go ahead and explain her doctor's recommendation that it is important, and I would go into the oral systemic link with the bacteria that's in her mouth can also go into her body, and with chemo and radiation her immune system is going to be really weak during that time, so the importance and care of her oral hygiene is very important. So when I was looking in her mouth, I saw that she also had extensive dental restorations from previous treatment. She has crowns and bridges, and she also has a partial denture on her mandibular. She also drinks fluorinated water and uses fluorinated toothpaste, which is great since the medications that she is on causes xerostomia, so she's already at a higher risk of caries. And so with her perio charting, I noticed bleeding on probing and that she had 4, 5, and 6 millimeter pockets. So I would recommend for her the modified Bass brushing method. Since this is a case study, I can't get her to show me how she brushes, but this is when I would take the time for her to show me. Then I would go ahead and make modifications. So I would then show her now to brush her gums up like this and swipe down. On her anterior, I would get her to brush in small circular motions, or she could go up and down, and I would tell her if she wanted to go up and down like this to do each tooth about 5 times. And then on her lingual, she could go up and down like this, or small circular motions, but I like it personally like this. I feel like I get it better. And on her mandibular, tell her to angle her toothbrush up 5 times per tooth, and keep going and make sure she stimulates her gums since they are quite inflamed and bleeding on probing. I would also recommend a tongue scraper with her xerostomia and getting coated tongue, so I would recommend a tongue scraper. I would recommend a floss threader. This is Super Floss that she could get since she has crowns and bridges. For a bridge, I would tell her to go under the bridge. So put it like that. And then I would tell her to swipe underneath the bridge to get any excess and stimulate her gums. Just for her regular teeth, I would, without crowns and bridges, I would tell her to go and do in between with the C method, go up and down 5 times. And on each surface, up and down 5 times. And go around her mouth. I would then get her to show me what she learned with her brushing and flossing. I would also recommend a interdental aid if she was out and about and didn't have time to floss, just to make sure that she's getting underneath those bridges and cleaning in those areas. I could also recommend an electric toothbrush if she didn't want to do the manual, and tell her the benefits, that how it pulsates on each tooth and it gets it way cleaner than we can manually. I would also recommend a non-alcohol mouth rinse. I have TheraBreath here for healthy gums. Since she has dry mouth, I would recommend this one because any mouth rinse with alcohol can contribute more to dry mouth. I would also recommend her to take out her partial when she is sleeping so that no other bacteria harbors underneath it. And if she was out and about and was eating a meal, I would recommend her to take out her partial and get a non-abrasive toothpaste and run it under water, and she can take her toothbrush and just clean out the excess food and rinse it and put it back in. And always just make sure to clean it overnight before she puts it back in the morning. I would also recommend her to massage her edentulous area to just get some stimulation to that area. And that is about it for Miss Margaret Snowden.